One of Bozeman's nurses is fighting on the front lines of the coronavirus in the country's hardest hit city. MTN's Gabby Crevitt has the exclusive story.
A nurse from Bozeman Health takes a leave of absence and experiences the devastation that is COVID-19.
They don't have the resources. There's too many people down here. This spread way faster than they thought.
12-hour shifts for 21 days straight.
I was so nervous because, this is out of my comfort zone. They told you that, you can tell them what your specialty is, but they're going to put you where you're needed. And there might be things that you're doing that you're not comfortable with, and you just need to do the best you can.
Munter was assigned to the night shift at the Roosevelt Island Medical Center in Queens, working with COVID-19 patients. She says personal protective equipment is low.
Those N95s are made to be worn one time. Same with these gowns are made to be one time. And here, you have to wear an N95 mask for 6 days before they'll give you a new one. I had some patients that were COVID negative and a couple that were positive. And so you're going into a room with a gown that you've been into a positive room with into a negative room. And that's just never the way you've been taught.
Resources compared to larger hospitals in New York City are limited at Munter's hospital, and she says the possibility of transferring patients can be impossible.
So I had a patient that I noticed that was really deteriorating and, really having a hard time breathing. And in the end, he ended up dying. And it's heartbreaking because the resources aren't here and they don't transfer the patient if there's not room for them.
And COVID-related deaths have become a harsh reality for Munter.
There is a refrigerated 18-wheeler truck at the back of our hospital, and there wasn't even enough body bags.
Munter says she worries about the mental health of recovering patients as well.
They're just really, going downhill because of the depression and the isolation, and you feel bad because you're like you and the day nurse are the only ones that they really have contact with.
Munter is near the end of her 21-day shift and has no regrets.
I feel, kind of makes me get teared up, but I feel accomplished that I had the courage to come here and help in some way. I feel like I've made a small difference, even though it's definitely not over here.
In Bozeman, Gabby Crevitt, MTN News.
Munter says things are starting to look better in New York City from when she arrived weeks ago. She looks forward to seeing her family soon, quarantining for 14 days, and then getting back to work at Bozeman Health.